back down. The uterus undergoes rapid reduction in size and weight after birth, should return to the pre-pregnant size by 5 to 6 weeks after delivery. If this does not occur, the term is subinvolution. Okay? It means it's not bringing back down. Uterine lining shed site is fully healed by about the 6 to 7 week mark. That's why it's important to make sure you follow up with your provider at 6, 7, 8 weeks postpartum. Make sure that everything is healed as planned, as it should. Okay, so descent of the uterine fundus. What proportion of the body of the uterus is the fundus? It descends at a predictable rate. Okay, so remember that the fundus is going to be an important word. And the fundus is how we kind of measure during pregnancy how well baby's growing, right? We can do a fundal height. After the baby's born, we're going to use the fundus to determine how well the uterus is shrinking back down. So right after the baby's born, you should be able to palpate that fundus right at the umbilicus, right at mom's belly button. After 24 hours, it's going to descend by 1 centimeter every single day until about day 9 or 10, where you should no longer be able to feel it at all. Okay. Lots of different terms are used. You may see 1 centimeter, 1 finger width, 1 finger breadth. Basically, for 4 days postpartum, and they should be about 4, this is not this big, but 4 fingers below the belly button. Okay. 3 days would be about 3 fingers below the belly button. So that gives the nurse, when they're doing their postpartum evaluation of the mom, kind of an idea. If the patient's 4 days postpartum and she still feels that fundus at the belly button, like maybe there's a complication going on, because it should be starting to shrink back down. The bladder, that's always in the way, can also have an impact on how well the fundus descends, how well the uterus shrinks back down. Okay. Remember, imagine that fundus is kind of right here. All right, if that fundus, or I'm sorry, the bladder's right here, and if that bladder starts to fill, it's going to push that uterus up, 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 up. So that could be one reason why the fundus is higher than it should be. If we don't do anything to empty the bladder and it's pushing, 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 it could push it all the way up and kind of toss it off to the right, where you may feel that fundus kind of underneath the right side of the ribs. Okay, so we want to make sure that this process can happen the way it's supposed to. After pains, those contractions don't end when the baby's out. You still have contractions. They're called after pains. They're not quite as strong as the uterine contractions of labor, but they can be pretty uncomfortable. And it's the uterus contracting to start to shrink back down. These rapidly go away, decrease rapidly within 48 hours. Moms who are breastfeeding may notice they may have more after pains because putting the baby on the breast and that newborn suckling releases oxytocin. And oxytocin contracts the uterus. Usually a mild analgesic is sufficient, Motrin, for after pains. Okay, lochia is our postpartum discharge. It's vaginal discharge composed of endometrial tissue, blood, and lymph fluid. It gradually changes characteristics during the postpartum period. Lochia should have a menstrual odor, but should not be foul smelling. If it's foul smelling, it's probably infection. That's true for a lot of things. Okay, volume should be assessed. We can have some periods where it's temporarily heavier, especially if mom has been laying in bed for a long period of time. She stands up, she could have a big gush of fluid. If she's been in bed and she's been breastfeeding the baby, remember breastfeeding is helping that uterus contract, that can cause a little bit of extra bleeding. Okay, so she may have increase in flow following prolonged periods of laying down or after breastfeeding. Moms who have had C-sections may have less lochia because they can really sponge out the inside of the uterus. They have access to everything when they take the baby out by C-section. not having any bleeding is not normal and could be a sign of a complication. Okay, so we're expecting to see this postpartum bleeding. So the transition of lochia goes from lochia rubra, which is red, okay, because it's mostly blood. That lasts about 3 days, to lochia serosa, which is kind of a pinkish color. It's blood mixed with mucus. That lasts another 3 to 10 days. And lochia alba, which is mostly clear, bless you, clear and colorless, and that can last 10 to 21 days. So roughly by the 5-6 week mark, this should be done. It's important to know that the progression of lochia, the normal progression is red to pink to white, right? It should be getting lighter and less volume. If we have a mom who's kind of had a couple days of some light pink, small volume discharge that all of a sudden starts bleeding a lot, that's a complication and she needs to follow up on that. So the parents, the moms need to know the progression so that they can notify their provider if something abnormal is occurring. Okay, the fundus is assessed routinely for firmness, location, and position. Okay, it'll be done more often if the mom is at a high risk for having a hemorrhage. The word they like to use in labor and delivery is boggy. Boggy meaning soft and squishy. After the baby's born, remember the uterus is a muscle and it should stay nice and firm and contracted. It should feel like a little rounded shelf when you palpate the abdomen. Okay. If it's a squishy shelf, that's not good. Okay, we need to massage that fundus. Massage the uterus, make sure, see if we can get it to contract. Sometimes that's all it needs is a little reminder to firm up. Make sure mom's keeping that bladder empty so that the bladder doesn't have any impact on the contractions, the uterus contracting. And we'll talk more about that in chapter 10. I just mentioned we need to teach the mom the sequence for lochia changes so that they can report anything that's abnormal, anything like foul-smelling lochia, persistent bright red bleeding, or the return of bright red bleeding after it's progressed to pink or white. Mild analgesics are good for afterpains. Any afterpains that persist beyond 48 hours should be reported to the provider. All right, the cervix regains muscle tone but never closes as tightly as during the pre-pregnant state. Some edema may persist for weeks. The vagina undergoes a great deal of stretching. Within 3 weeks, the vagina should regain most of its pre-pregnancy form but never returns fully to the pre-pregnant size. Nursing care. Couples may be hesitant to ask questions concerning sexual activity. Discussed before how after the baby's born, the doctor will come in and be like, "What are you going to do?" Like, this newborn. That's what I would use for birth control, right? But if you're not careful, you can show up at your 6th checkup with a +1, an Irish twin, huh? No. The reason why you should wait to see the doctor is the doctor's job is to make sure that you have fully recovered from childbirth. Okay, that involution is complete, the uterus is back down to where it's supposed to be, that site where the placenta was attached is fully healed. So remember, that's like a big open wound once it's detached, once the baby's born. So making sure all of that healing is complete. You should wait until you go here. Okay, RITA is an acronym that we can use to evaluate an episiotomy. You could also use it to evaluate a C-section incision. You could really use this to evaluate any incision or laceration or break in the skin. Okay, REEDA. Redness, edema, ecchymosis, discharge, and approximation. Any break in the skin or incision, laceration, hair that's been repaired, when you evaluate it, you're going to look for redness, any edema or swelling, ecchymosis or bruising, discharge or drainage that may be coming out, and approximation, meaning do the edges line up nicely, or has a suture, torn or something like that, suture fallout. Okay, so they use it a lot for episiotomies and lacerations, but you could use it for anything. Okay, comfort and hygienic measures are the focus of nursing care and patient teaching. Ice packs, these 12 to 24 hours for that mom who's vaginal delivery. If she had a C-section, unless she pushed for a long time before that C-section, she probably won't need ice packs. If she had a vaginal delivery, she's going to want some ice packs. After 24 hours, heat is very helpful. 6 baths, heating pads. Heat promotes circulation, helps blood flow to the area, which helps with healing. The woman's going to do pericare, perineal care, after every void or stool until her postpartum checkup. And that means with a little peri bottle, if you've not seen one, they're little squeeze bottles with a little nozzle on top that has a bunch of holes. So every time she uses the bathroom, rather than using toilet paper to wipe and clean, she's going to use the peri bottle to rinse and then kind of pat dry. We don't want to, probably not going to want to do a lot of wiping, but also we don't want to transfer any bacteria to a potential episiotomy site or a laceration or anything like that. Okay, so use that peri bottle and let it dry. We have topical and systemic medications that can be used to relieve pain. They have sprays that contain lidocaine that are numbing for moms who have bad lacerations. Witch hazel pads or tux pads in a sitz bath can help with hemorrhoids. It's not uncommon for women to have hemorrhoids during pregnancy that flare up during pregnancy and then become even worse after a vaginal delivery. Little pillows or donut-looking pillows are also helpful. It kind of takes the pressure off the perineum. All right, here is another acronym for maternal assessment. We will use this when we do our sim lab. Bubble heat. This maternal assessment tool kind of jogs our memories to the things we have to look at in a postpartum mom. Okay, so if you remember bubble heat, you'll remember all of the things that you need to look at for somebody who's postpartum. So our first B is breasts. Every patient who's had a baby, they'll do a breast evaluation. They'll look for engorgement, make sure there's no cracks or blisters on the nipple. Even if mom is not wanting to breastfeed, we're still going to check and make sure there's no engorgement. The U is for uterus. Is it firm? Is it boggy? Where is it? Is it where it's supposed to be as far as descent? For how many days out from delivery that patient is. Bowel and bladder are the next two. Bladder is important. We want to make sure it's not distended.
Thank you.
If the patient's a few days out and she's up and using the bathroom, then that's fine. Bowel movement that doesn't always happen in the hospital after the baby's born, but we can still ask. Lochia, what's the lochia like? Is it appropriate for how far out from delivery the mom is? E is episiotomy. Check the episiotomy if she had one. If she had a C-section, you can, mentally swap that out for the C-section incision. The H is for Hohenstein. You guys heard of Hohenstein before? Maybe in cardiac, checking for a blood clot. Basically, if you take the patient's leg, this is for anybody, not just a postpartum mom, but if you take their foot and sharply flex it towards their head, very quickly flex their foot towards their head. Pain in the calf is a positive Hohenstein. Okay, it doesn't necessarily mean the patient has a DVT, but they should have more tests done to make sure they don't. Because calf pain is a positive Hohenstein. You would check both lower extremities. Hey, there's gonna be some moms that are more at risk for clots developing, right? Moms that have had C-sections, if they're not, jumping up out of bed and ambulating around the hallways right after major surgery, they're at an increased risk for blood clots. Okay, and then emotional status and bonding. You always say, how's everything going? Do you need any help? Is the baby feeding okay? It's kind of how you cap off every visit to the room. Our interconceptual care is the care between babies. Discussion regarding contraception should be initiated before discharge. I mentioned a little bit ago. Postpartum care beyond 6 weeks is termed interconceptual care for a period of a year. Ideal spacing is approximately 2 years between pregnancies. No complications. Ideally, I guess how the body heals, 2 years is up. Making sure mom is in between. All right, for next, and we'll talk more about breastfeeding later on this chapter, so next week. Changes occur for both nursing and non-nursing moms. Okay, you still have to evaluate each mom, whether she's breastfeeding or not. Remember, the baby's born, the body's going to make breast milk. Okay, that's what happens. And if you want to breastfeed, then you have to tell the body that you're using the milk and you need to keep making the breast milk. Okay, and you do that by putting the baby to breast frequently. If baby's able to nurse, then using a pump. Something to give that nipple stimulation, that sense of signal to the brain saying, I need this milk, I'm using it. On the other side hand, if you don't want to breastfeed, you don't want to do any of that, right? You have to kind of get over the hump, the engorgement, and milk coming in, and then eventually the body realizes, I'm not using this milk, I'm not going to make it anymore. Okay, it's very much supply and demand. So both moms are going to end up having some engorgement, whether they're breastfeeding or not. And when the breast is engorged, it's very hard, it's uncomfortable. The nipple may be kind of flush with the skin, which makes it hard for the baby to latch on. So, kind of don't want to get to that point if mom is breastfeeding. Hopefully get the baby latched on before the engorgement gets too bad. If mom is not breastfeeding, then the breast will return to their normal size within a week or two. At each assessment, the nurse checks the breasts for consistency, size, shape, and symmetry. The nipples are inspected, make sure there's no cracks, no bleeding, no blisters. Usually if there is, it's because the baby is not latched on correctly. This used to be very heavy on nursing, but now pretty much every hospital has lactation consultants in the units almost 24/7, if not at the very least every day. Okay, so, 3 in the morning, the nurse might have to go in and help a mom with breastfeeding, but they should always follow up with lactation consultants because that's their jam. That's what they do. Okay, that's all they do is help with breastfeeding. So utilize them. Okay, bra should be worn to support heavier breasts. Should be firm support, but not cutting off your circulation. Moms that are not nursing, I mentioned a little bit ago, avoid anything that's going to stimulate the nipple because that'll send that signal to the brain saying, oh, I must be using this milk, and you'll just make more. So no pumping, don't put the baby on the breast just to relieve some of that engorgement. Hot shower, like the shower spray, even from the shower head, could stimulate milk production as well. And it's hard because when that engorgement occurs, you just want to pump some of it out to release some of the pressure. All that does is tell the body, oh, I guess I'm using this milk, and they're going to make more. All right, the cardiovascular system. Remember, way back in chapter 4, we have an increase in circulating blood volume when pregnancy occurs, right? So we have increased circulating blood volume to accommodate the, increase in maternal tissues, the baby's blood supply, all of that. And also for blood loss at delivery. So moms can lose up to 500 mLs during a vaginal delivery and 1,000 mLs for a C-section. Anything above that is considered a hemorrhage, a postpartum hemorrhage. And we'll talk more about postpartum hemorrhages in chapter 10. Even with that blood loss, there's still an increase in blood volume and cardiac output because blood that was going to the uterus and the placenta and all of that is now being redirected everywhere else. Okay, so that can lead to some bradycardia because you have more blood circulating, so your heart can pump a little slower. Lots of extra fluid as well, so not uncommon to hear moms complaining that they're very sweaty and they have to pee a lot. Plus, they give you a ton of IV fluids usually when you're in labor anyway. So, but that's how we get rid of all that extra fluid. You pee it out and you sweat it out. Clotting factors are still high for 4 to 6 weeks after birth. We don't have an ability to break down those clots. Okay, so it does increase the risk for having a thromboembolic disorder, which we'll get into more in chapter 10. Definitely at a higher risk if there's a history of like varicose veins, history of C-section, or some reason why the mom was not able to get up and ambulate around. Those are all risk factors for a clot anyway, is bed rest. Shortness of breath and tachypnea are signs of a pulmonary embolism, so we have to watch for that. All these things you don't really think about after you have a baby, but not impossible to happen. Women who had C-sections, sometimes they automatically give them prophylactic anticoagulants like heparin after the baby's born for a few days until they're up and ambulating a lot more. They may get the Venodyne boots or the compression devices for their lower extremities if they're not getting up and ambulating that much, just to help that circulation from the lower extremities. Blood, how are we doing on time? Do a couple more slides here. All right, blood values. After the baby's born, it's not uncommon for the white count to increase. Okay, if you think back to probably A and P, when there is damage to a tissue, right, white blood cells increase. They rush to that site to fix the problem. Right, if there's damage to tissue, if there's infection, the white count increases. So as far as they're concerned, like a traumatic event has happened and they want to fix it. So all those white blood cells increase. Not uncommon for that to happen. But we can't use it as a marker for infection because they're going to be high. We're expecting them to be high. Okay, it doesn't return to normal until about 12 days postpartum. Chills are absolutely normal after the baby's born. There's a huge shift in fluid and hormones and all of that. Lots of moms have uncontrollable shaking after the baby's born. They will tell you they are not cold. They're not.
I had it before.
Huh?
I had it before I had the baby.
Before you had the baby?
Yeah.
Sometimes, when you're fully dilated, if you're,
It was terrible.
yeah, you start with the chills. The warm blanket. What she said?
They kept giving me blankets and it was pissing me off because I'm not cold.
Well, that's what they deny being cold, but everybody wants to like give a blanket because they're literally like uncontrollably shaking. You know, in the operating room, sure, it's cold in there. They may not feel cold, but they don't necessarily care with the warm blanket. But yeah, to keep layering on, and it's probably a warm blanket, like from a blanket warmer. Those are nice at about 3 a.m. when that 3 a.m. fatigue hits. So there's no rhyme or reason behind it. Like there's nothing wrong. They have these chills. It doesn't mean they're sick. It's very common after the baby's born. It usually goes away within an hour or two. Give them a blanket. Okay. Orthostatic hypotension still is very much an issue, especially right after the baby's born. It is not uncommon for the first time out of bed for moms to stand up and go whoop, right down. Okay, they stand up, there's usually like a gush of blood that's pooled in the uterus that goes down, and they are a little unsteady on their feet, so nobody should be getting up out of bed without assistance until they are steady on their toes. Temperature increase. We also expect a slight increase in the temperature right after the baby's born for the first 24 hours. So can't really use that as a marker for infection either. Okay, temps after 24 hours are concerning. We're checking for edema in the lower extremities, hands, and face. Okay, we talked about preeclampsia during pregnancy. Blood pressure issues can still exist after the baby's born. Some moms develop postpartum eclampsia. Okay, so we have to look for swelling in the feet, hands, and face. Checking for clots. So looking at the caps, looking for red, tender areas, swelling, positive Homan sign, all of the things that we looked at on our bubble key tool. Risk for falls, yeah, just because there's lots of fluid shifts. Center of gravity is a little bit off now because they got so used to being a little front heavy, and now the baby's out. So always better to just have somebody helping them walk around for the first few times out of bed. All right, decreased tone of the bladder and ureters from pregnancy, with the addition of all the IV fluids they like to give, can cause the bladder to fill up pretty quickly. But after the baby's born, she may not empty it completely. Remember, the tone is decreased, but also the pressure of the baby is not there anymore. So she may not realize that she hasn't voided all of the urine that's in there. She could also have had a spinal or an epidural, and maybe can't sense that her bladder is filling up. Okay? So if that's the case, we definitely have to palpate the bladder. Make sure it's not getting distended, because that can cause a postpartum hemorrhage. It can also increase the risk for UTI, but postpartum hemorrhage can occur. I have a couple more slides. UTI system usually resumes normal birth. Mom's going to be hungry. Better be with food throughout the whole labor. If she's in the hospital, they're probably not letting her eat. So those gourmet turkey sandwiches ready for her. Constipation is not uncommon, just from medications that she might have been given. And the abdominal muscles are stretched, making it a little harder to bear down. Some moms might literally be afraid to poop, especially whether they've had a vaginal delivery or a C-section. The first time is going to be scary for them. Also dehydrated, which can make stools a little bit firmer or a little bit drier. So encourage fluids, add fiber to the diet. Most of the time they put them on a stool softener too to help. Skin, hyperpigmentation of the skin, the chloasma, the mask of pregnancy that some women get, that darkened pigmentation on the cheeks, usually the bridge of the nose, and linea nigra is the darkened line that some women get on their abdomen. Those will go away as the hormone levels get back to normal, but the stretch marks are for life. Can't get rid of those. They fade. They fade from like a reddish purple to a silver color. I did see some people, there was something like people were getting theirs tattooed, like to match their skin. Yeah. Right? Whatever, they're there. All right, 2 more slides, and then we'll stop. Musculoskeletal system, the abdominal wall's been stretched during pregnancy. I enjoy the word doughy. It has a doughy appearance. Okay, women are often very surprised that they still look pregnant after the baby's born. And from having a 9-month pregnant belly that's usually pretty firm, because the uterus is firm, the baby's in there, that's all gone, and it's very squishy feeling. It's because everything's not settled back down into place yet. Okay. Hypermobility of the joints stabilizes within 6 weeks. The joints in the feet remain separated, which is why if your foot got bigger, it stayed bigger during pregnancy. And that center of gravity returns to normal. RH incompatibility, we talked about this in chapter 5, right? If mom is RH negative, RhoGAM. So mom will get her second dose of RhoGAM after the baby's born. And even though it's not an issue for that baby anymore, it's going to prevent the formation of those antibodies for a future pregnancy. And then rubella immunization, titers would have been done early on in pregnancy. If she is not immune to rubella, then she'll get her MMR vaccine after the baby's born. Right? We don't give that during pregnancy because rubella is toxic to the child. Because what?
It was at a test that we were asking each other. I was like, is it before or after?
After.
I was ready.
Alrighty, good place to stop. We'll talk about changes we have to make to this care next week.